Hello, how are you? Today I've picked out for you 3 types of itching that are a warning sign from our body. I don't know if you experience any itching, but if you do, write it for me down here in the comments, because feeling itchy is actually pretty common, and often it might be nothing. But with these 3 types of itching, we really need to pay close attention to the location, the duration, and the kind of itch you have. They can definitely be a sign of a serious health problem, so it's important for you to know about them. Stick around until the end, you won't want to miss this. So, before we start, I want to know, do you experience any itching and for how long? Has it started itching recently or has it been itching for a long time? I'd love to see your comment. Remember to like the video. That's really important to me. It shows YouTube that you support the channel and that you trust my content here. And if you know someone who suffers from this problem or is worried about it, share this video. Let's work together to expand this chain of kindness. That's what I want here with the channel. The first tricky itch on our list is when the palms of your hands and the soles of your feet itch. Everyone can have a little itch in that area from time to time, but it's a warning sign when the itch is intense, deep, persistent, and gets worse at night without any visible skin lesions. This can be associated with a liver problem, especially when there is difficulty with bile flow in our liver. The liver is responsible for producing and eliminating bile. Bile helps with digestion. It's like a detergent that helps break down fat, aiding in the digestion of our fats. And when this flow is impaired, some substances accumulate in our blood and can irritate the nerve endings in the skin from the inside out. So that's why the person keeps scratching and scratching but doesn't see anything on their skin, because the problem isn't in the skin. So, this type of itching deserves investigation, especially if, in addition to the itching, you are feeling more tired than usual. It's an excessive tiredness. If your urine is darker than normal, if your stools are lighter, and if you have yellowish skin or eyes. So, it's no use changing your soap or applying more lotion. What's really important is that you see your doctor to have clinical and even laboratory tests done to confirm if your liver is okay. The second type of itching is persistent anal or genital itching. This is a type of itching that deserves attention, and it's a very sensitive topic, right? Because many people avoid talking about this, they're embarrassed. But for those of us in healthcare, we can't be embarrassed. We have to alert people about it. This topic is extremely important, especially for older people. It can indeed be related to hygiene issues, and that's one aspect, but it can also be linked to candidiasis, hemorrhoids, or dermatitis. It could be things that are relatively simpler to resolve, but it can also be related to serious health problems, especially when this itching lasts for many weeks, doesn't improve with hygiene or basic care, keeps coming back, and may or may not be accompanied by pain, bleeding, discharge, or changes in the skin at the site. In some cases, this persistent itching can be associated with chronic inflammatory diseases, persistent infections, and even, in more specific cases, tumors in the genital or anal region. Of course, this doesn't mean that any itching in this intimate area is a tumor or cancer, but it's important for you to see a doctor if this itching is very frequent and doesn't go away, because even if it's not a tumor or something more serious, as I mentioned, it could be another health condition that, if left untreated, could get worse. So don't be embarrassed, go to the doctor. The doctor will never mock or laugh at you. Seek help in this regard. The third type of itching, which can be serious, is the kind that affects the whole body when the person seems to have normal skin, no spots, wounds, or irritation, but feels intense itching, often worse at night, and it doesn't get better even after applying cream or moisturizing the skin. This type of itching may be related to systemic problems such as kidney issues, blood disorders, or metabolic disturbances because the blood is closely connected to the filtration. Our kidneys are very much related to filtering our blood, filtering toxins and metabolites that need to be excreted through urine. So when the kidneys can't function properly, we can have a buildup of these toxins in our blood, in our body, and this causes that sensation of diffuse itching all over the body. What's tricky is that these early kidney diseases usually don't cause pain or any very specific symptoms. So itching is one of the symptoms that stands out the most. If the itching comes along with swelling, extreme fatigue, changes in the amount or frequency of urination, high blood pressure, or poorly controlled diabetes, that's another red flag, in addition to the yellow warning light, because it could already be a sign of something more serious related to kidney problems. And again, it's very important to see a doctor to confirm. Remember that this video is purely informational, and the itching I mentioned could be related to these health issues or others, or it might not be any of the things I talked about and could be something else entirely. So, the idea of the video is to help you, but the diagnosis should always be made by a doctor in person. Besides these 3 types of itching, which are usually more related to more serious health problems, itching can also be associated with other conditions that aren't necessarily as serious, but can over time gradually worsen if not properly addressed. Blood diseases, such as certain types of anemia and even some lymphomas, which is a much more serious condition, blood cancer, can cause itching. So usually when there is extreme fatigue, paleness, night sweats, unintentional weight loss, and noticeable changes in blood tests, these signs can be related to a condition associated with underlying blood disorders. Itching can also be related to hormonal or endocrine changes. Thyroid problems, especially hypothyroidism, can cause itching because the skin becomes drier. Itching can be a side effect of some medications, antibiotics, opioids, blood pressure medications, cholesterol drugs, but you should never stop taking a medication or change the dose on your own. So if you started taking a medication and began to feel more itching, you need to talk to your doctor because they might adjust the dose or even change the medication to avoid this side effect. Some autoimmune diseases and infections can also cause itching. So, as I'm telling you, we can't just say, it's exactly this. If you've been experiencing itching that doesn't go away, even after maintaining proper hygiene, moisturizing your skin, and trying to take care of it from the outside in, you need to look from the inside out to see if it's a sign your body is giving you. Our body is very wise. It always tries to warn us when something bad is happening. So let's pay attention, right? Let's practice this self-care by paying more attention to what's happening in our bodies. So tell me, do you experience any itching? Have you ever seen a doctor about it? When you did, were they able to link it to any health issue? Has it improved? I would love to read your comment. Remember to like the video. It really helps me here on the channel, and share it with anyone who might enjoy it or needs it. Let's expand this chain of kindness together. That's what I want here with the channel. See you next time. Bye.